Hi, I'm Stacy. Welcome to the Herma Heart Center at Children's Hospital of Wisconsin. The cardiac program in the Herma Heart Center is consistently ranked among the top pediatric heart centers in the nation. We'd like you to have a great experience during your time with us, so we've created a tour video to help you have a better understanding of what a visit here would look like. During the tour, we will be following one of our heart heroes, Caleb. He's coming to see a cardiologist today and is going to be having some tests of his heart completed. We offer a lot of different tests in the Heart Center. Today we're going to take a closer look at 3 of those tests: an EKG or electrocardiogram, an echo or echocardiogram, and a heart monitor or a Holter monitor. When you first walk into clinic, you will meet one of our clinic secretaries. They may need to ask you a few questions before you see your doctor. Once they find out everything they need to know, they will ask you to please take a seat in our waiting room until your name is called. Sometimes, when kids come to clinic, they might have to do some waiting. It helps to bring a couple things to do so you won't get bored. Many kids bring activities like coloring books and crayons, dry erase boards, a Magnadoodle, books, a handheld game system, or even a tablet.
Caleb?
Okay, buddy. At each cardiology appointment, a clinic assistant will check how tall you are and see how much you weigh. It is important to check these at every appointment because how much you are growing helps the doctors understand how your heart is working. Once they know your height and weight, you will follow our clinic assistant to a clinic room where you will wait to see the nurse. Knock, knock. Hi, guys. Is this Caleb? How are you guys doing? The nurse will talk to you and your parents about how you've been feeling and do a couple of things to see how your body is working on the inside. He or she will give your arm a hug with a blood pressure cuff. They will also listen to see how your heart is beating with a stethoscope and check how you're breathing with a Band-Aid around your finger called a pulse ox. After that, the doctor will come in and talk with you and decide if you need to have any other tests done to check how your heart is working. Dr. Frommel decided Caleb needs to have a few tests done today. We are going to follow him so you can learn more. The first test he's going to have is called an EKG. An EKG or ECG stands for electrocardiogram. This is a test doctors use to see how well your heart is beating. This is what the room looks like where you will have your EKG. There is a bed to lay on and a machine that looks like a laptop computer to record how your heart is beating. There may be some other things in the room too, but they won't need them for this test. You will have to take off your shirt or lift it up because a person called a tech will put stickers called electrodes on your chest and stomach. Sometimes even 1 or 2 on your arm or leg. Don't worry, they don't hurt or shock you in any way. You won't feel a thing. You can help count the stickers as they go on. Then the tech will attach wires to the ends of the stickers. You can help count again to make sure the number of stickers and wires are the same. Once the stickers and wires are in place, your only job is to hold still and breathe normally. The machine does the rest of the work. After a few minutes, it will print out a long piece of paper with squiggly lines on it to show the doctor what your heartbeat looks like. The tech will then take the wires off. Once the wires are off, you can decide if you would like to take the stickers off yourself or have someone else help you. They actually aren't too sticky, but can pull a little if you have hair on your body. That's it. The EKG is all done. Now Caleb's headed to echo. Echo is short for echocardiogram. This test allows doctors to see different pictures and measurements of your heart to let them know how your heart is working. This is what the room looks like where you will have your echo. There is a big bed for you to lay on, chairs for your parents to sit on, a computer screen that shows the pictures of your heart, and even a TV for you to watch a movie while they do the rest. Caleb likes to bring his own movies from home, but don't worry, they have a binder full of movies for you to choose from if you forget. You will have to take your shirt off or lift it up because the tech will have you lay flat and put 3 stickers on your chest and stomach. These stickers do not hurt either. Then they will have you lay on your side and put your arm underneath your head. and then they will take more pictures while you're laying on your back. This helps so they get a really good picture of your heart. The tech will then use a special camera that looks like a wand with warm jelly on it to take pictures of your heart. That's why Caleb's family actually calls echoes jelly pictures. The jelly helps the wand slide easily on your chest, stomach, and neck. This doesn't hurt at all. And don't forget, you can watch a movie the whole time. When they have enough pictures, they will wipe the jelly off, remove the stickers, and you can put your shirt back on how it was. Now it's time to talk with Dr. Frommelt before Caleb gets his Holter monitor put on.
Everything looks great. There's a little bit of leakage through the valve, but it looks really stable.
The doctor can tell you how your test looked, if you'll need to have a Holter monitor placed, like Caleb, and tell you when you'll come back to see your doctor again. A Holter monitor is a lot like an EKG, but you get to wear it at home. It tells the doctors a lot of information about how your heart is beating. The sticker or stickers stay on for a whole day or longer so they can learn what your heart is doing while you eat, while you play, and while you sleep at home. Luckily, the stickers aren't connected to a machine on wheels like the EKG. Sometimes they are small stickers on your chest connected to a small little computer that fits in a backpack. And sometimes it's just one big sticker with a tiny computer in it. When Caleb comes back for his next appointment, they will be able to get the information they need about how Caleb's heart is beating from the small computer. That's it. That's the end of Caleb's visit. It's time for him to go home. We hope this tour video helped you learn more about what to expect during your visit with us in the Herma Heart Center. If you still have worries about tests or procedures that may be completed during your visit, please let us know. We have child life specialists that could help you feel more comfortable with your visit and in preparation for your stay with us. We hope to see you soon.